When you start your clinical exam, you should do so with a hands-off assessment. Take a look at the horse and note its demeanour, if it's weight-bearing and moving normally, and if there are any signs of pain. Look at the environment for evidence of what the horse is eating, how much it is eaten, how much it has been drinking, if there are any disturbances to the bedding, and if any past urine or faeces is of normal quantity and appearance. If possible, it's best to take a respiratory rate at this stage. Watch the horse's flank movements for at least 15 seconds and multiply up to breaths per minute. You can now perform the hands-on assessment of the clinical exam. The horse should be restrained in a head collar, either tied up or held by a handler. First, start at the head and look for any evidence of nasal or ocular discharge. Assess the colour and quality of the mucous membranes by lifting the lip and checking the gums. They should be pink and moist. Press a thumb against the gum to investigate capillary refill time. This should be less than 2 seconds. Next, palpate either the transverse facial artery, caudal to the lateral canthus of the eye, or the facial artery on the medial surface of the lower jaw. You'll be assessing pulse rate and quality. Move your hand immediately to between the mandibles to palpate the submandibular lymph nodes and check for any swelling. Continue caudally and palpate the jugular vein to assess if it raises in a normal manner. Next, auscultate the heart to listen for rate, rhythm and murmurs. Count the heart rate for at least 15 seconds and multiply up to beats per minute. Also, auscultate the lung fields to assess for any crackles or wheezes or any regions of absent airflow. Make sure to auscultate the entire lung field. Move to the abdomen to auscultate for gut sounds. Listen for the frequency and nature of borborygmi in the dorsal and ventral quadrant of each side. Next, assess for ventral edema, then palpate each limb for swellings, effusions, and digital pulses. Remember to repeat the palpations and auscultations on the other side of the horse. You can also perform a body condition score as part of your clinical exam. The last step in your exam is to take a rectal temperature.